Welcome to Monday's edition of COVID-19. We are starting this work week with cases on the 300 level, while over the past 10 days, more than 310,000 people have received their first dose of the vaccine. Authorities have also vowed to take a firm stance against disinformation regarding vaccinations, and we have more on this effort with our panel of experts later on in the program. Here first, Kwon So-ah with the broader pandemic coverage. So let's start here in Korea for this Monday.
Well, Sunny, although we are seeing a decline in cases this Monday with 346 confirmed infections as of 12 a.m. and also a drop in both domestic transmissions and imported cases, this is largely attributed to less testing over the weekend. And the total number of cases here in Korea stands at 92,817, with 1,642 people having lost their lives from the virus and over 7,700 people remaining in quarantine or under treatment. Now, sporadic cluster infections continue to break out across the country. We're still seeing double digits, especially triple digits in the metropolitan region. And in Gyeonggi-do province, the city of Ansong, 50 infections were linked to a livestock market, and also infections are continuing to emerge among private gatherings. Now, every day this month, we have been seeing infections either in the 300s or 400s, and that's been the trend now for weeks. So this could be translated into a much more stable situation than during the peak of the third wave late last year, but with no clear downward trend observed either, the risk of sudden resurgences still remains. And that's also why the government is still cautious in determining the beginning of new social distancing measures, which would be simplified into a 4-tier system from the current 5-tier scheme, and also focus on more freedom and responsibility.
I see. Meanwhile, so on the vaccine front, I understand we are progressing quite well.
Well, Sunny, so far over 41% of the roughly 764,000 people that are prioritized in receiving the first COVID-19 shots have been inoculated with their first dose of either AstraZeneca or Pfizer vaccines. So with that, the total number of vaccinations stands at 316,865 as of this Monday, with a little over 2,000 vaccinations conducted on Sunday. We usually have less inoculations over the weekend. Now, turning to the international front, a country that has completed vaccination on 40% of its population, Israel, is now in its final phase of easing lockdowns, opening restaurants, bars, and coffee shops for so-called vaccinated Green Pass holders. Now, in some spots around the world, people are, however, demonstrating against what they call measures against freedom, including in the U.S.'s Idaho, where even kids were encouraged by their parents to toss their masks into a fire in protest against virus restrictions. Now, although the U.S. has been seeing declining figures in recent days, authorities are saying don't drop the mask yet, as there are also variant cases spiking, and that includes in Italy, which has hit the 3 million mark over the weekend, while Brazil is now inching closer to the number of total cases in India. And the total number of infections around the world stands at 117.4 million, with some 2.6 million fatalities. And those are the updates I have for now. I'll be back with more after the government briefing. Sunny?
All right, So thank you for now. Meanwhile, authorities in Japan have extended their state of emergency in the Tokyo area for 2 more weeks. That is until the 21st of March, as Japan struggles to contain some 1,000 daily infections in recent days. Now, for more on the situation there, I have Hiroaki Wada live on the line. Hello, Hiroaki.
Hi, Sunny. Thank you for having me.
Right, Hiroaki, what appears to be fueling the rampant spread of the virus there in Japan?
Actually, the number of new infections has been going down in recent days. But one worrisome trend is that the pace of slowdown is kind of being reduced, and we see more cases of overseas variants spreading among certain areas in the country. So some experts are already talking about the fear of the fourth wave of infections. So we have to be really, and as you mentioned, the government extended the state of emergency for 2 weeks. But as you mentioned, rate of new infection is the slogan is not coming down as we had hoped, and people are getting really tired of taking precautions and protective measures. They don't know what to do because they have been doing things told by the government so eagerly. So people are getting really worried about the current situation.
Hiroki, I understand Japanese regulators took quite some time approving the Pfizer vaccine, and public inoculation started on the 17th of February, but its pace has been quite slow. How do you explain this reality?
Well, one of the reasons is because the Japanese authorities conducted its own test of the overseas produced vaccines, which had already been approved in other countries. And one of the reasons the Japanese authorities had to do that is because of the general public fear about vaccination, which was kind of started several years back when we had side effect cases involving some cervical cancer vaccination. And because of the widespread reporting by the media of those cases, become really cautious about promoting vaccination. And as a result, many vaccine makers kind of become hesitant about going ahead with more vaccine production capacities. And some experts are saying that that kind of situation behind Japan's delay in developing its own vaccines, even though there are a number of producers who are working hard to come up with their own versions.
I see. Hiroki, I also hear there's been some controversy regarding Japan's vaccine procurement talks with Pfizer. Can you tell us a bit more about this?
Well, one of the things that government is saying that, well, we did have some arrangement with Pfizer about getting certain amounts of vials, but they are not coming in time or they're not coming as we had expected. But as you know, the vaccination for the medical workers have begun last month, and so far some 46,000 medical workers have received the shots, but it's not enough, obviously. And we also have to wait until mid-April for the elderly people who have higher risk of becoming seriously ill after infection to start. So public discontent about the slow pace of vaccination is very high, even though it's not really explosive yet.
I see. Hiroki, earlier this month, some 140 vials of Pfizer's vaccine had to be discarded owing to a freezer malfunction. Could you tell us a bit more about this? And also, what is the latest with regard to the lack of special syringes for the Pfizer vaccine?
Right. As for the case of discarding the vaccines, it is, I understand, because of mechanical failure or something with the freezer. And the incident happened over the weekend, so there was no one at the office at the medical institution to check the temperature of the freezer, which was going up slowly. And as a result, when officials found that temperatures are too high, they have no choice but to discard the vials inside, which are enough for 1,000 shots. And regarding the syringes, yes, the government could not procure enough amount of syringes which can take out like 6 shots out of one vial because it has less dead space inside. And it looks like we have to wait until the end of March.
I see.
To get enough number of syringes to make the full use. Yeah.
I see. Hopefully that will be possible. Hiroki, I hear the Tokyo Olympics may be held in the absence of spectators from abroad. Can you tell us a bit more about this as well?
The Manchin reported about the possibility, and the government is saying that they have to have a discussion with the International Olympic Committee, International Paralympic Committee, the Japanese government, and the Tokyo Metropolitan Government to decide on the issue before the start of the torch relay, which
Right. I see.
And our reporting says that the government is going ahead with that direction, meaning that there will be no more overseas spectators.
I see. All right, Hiraki, as always, thank you very much for your time and thoughts.
Thank you so much for having me.
Right, and to our viewers here, we do apologize for the disruption in our connection with Japan. Now, it's time now for the regular afternoon briefing on the COVID-19 situation here in Korea for this Monday. Despite the fewer number of tests this past weekend, as Kwon-Soo mentioned earlier, the daily number of infections stood at over 400 on both Saturday and Sunday. Accordingly, authorities are calling for greater public caution while highlighting the danger of complacency. Having said that, let's take a look at the current prevention measures here in the country. The Greater Seoul area faces level 2 social distancing guidelines, while the rest of the country faces level 1.5. The ban on gatherings remains in place, with 5 or more people not permitted to meet for social purposes. An exception has been granted to immediate family members only, that is, including grandparents, parents and children. And a few businesses, including movie theatres, internet cafes, video game arcades, cram schools, amusement parks, as well as retail stores, face no limit on operation hours. Meanwhile, restaurants, cafes, indoor gyms, singing rooms, party venues and indoor standing concert places can be open until 10 p.m. here in the metropolitan region, while those elsewhere nationwide face no time restriction. But all nightlife entertainment establishments, including bars, can only accommodate patrons until 10 in the evening. Also, movie theatres and performance halls are being asked to leave one seat empty between patrons or parties. Sports stadiums here in the Greater Seoul area can host 10% of their capacity, while those elsewhere can host 30%. The attendance cap on weddings and funerals stands at 99 here in the metropolitan region and 499 in the rest of the nation. Places of worship are to abide by a 20% capacity here in the metropolitan region for regular sermons and a 30% capacity elsewhere. Other religious activities such as Bible study, choir practice, meal sharing and lodging remain banned nationwide. Now, we are still waiting for the briefing to start, and perhaps while we wait for that briefing to commence, we could perhaps take a look at today's COVID-19 numbers, that is, for this Monday here in Korea. As I mentioned earlier, we have 346 new infections on this Monday, raising our total to over 92,000. We also have 8 losses of lives, raising our total death toll here in the country to 1,642. Those quarantines stand at 7,701, while we have 83,474 who have fully recovered from the disease. We are still waiting for the briefing to commence, and perhaps while we wait, we can have a small talk with our consul regarding the number of people who have been vaccinated thus far. For the past 10 days, and as I mentioned earlier, we have more than 300,000 people vaccinated, right, Swa?
Right, 316,865 to be exact. And over the weekend, we also had thousands of new vaccinations, including some 2,000 on Sunday. I think the briefing is about to start.
Right, we have just heard, that is, that the briefing is about to start. And once it does, we will come back to you with a summary of it with our consul again.
Today we have Commissioner Chung Eun-kyung, and we also have a follow-up briefing on the adverse effects of the vaccination, as well as other reports related to the inoculation. First of all, here is Commissioner Chung Eun-kyung. Let us now begin our regular briefing on the COVID-19 situation, including the inoculation status. And as of March 8th, Monday, we have 335 new local infections and 11 new imported cases. The total caseload now stands at 92,817. And currently we have 7,701 people remaining in quarantine, and there are 128 patients with critical or severe conditions. We had 8 additional fatalities. The accumulated death toll now stands at 1,642. I extend my deepest condolences to the deceased and the members of the bereaved families. As for the detailed numbers of the cluster infections, please refer to the press kit. And we have some updates on the weekly trend. On a weekly basis, daily average, we have about 370 cases, which is about 0.6% increase from the previous week. And on the daily average, we have 19.4 cases of imported cases, and this has dropped from the 30 range to about 20 range, and we are seeing a continuous drop. And by region, in the metropolitan area in Chungcheong, Gyeongnam, and Jeju, we also see a on-week increase in the number of confirmed cases, while in other regions we have an on-week decline in the number of daily cases. And as for the sources of infection, we see that 34.5% are contact with the previous cases, and about 17% are also cluster infections. And also at hospitals and nursing hospitals, we have seen that we have had about 4.5%, which is a large drop from the previous week, which stood over 13%. And we also have quite a number of cases under investigation. And we also had 21 new cluster infections being reported during the past week. And 9 of them were family and social gatherings, and also manufacturing and other office spaces were also 7. And we also have foreign clusters like the Dongducheon and the Sejong's military units that have been reported as new cluster infections. And we see a continued decline in the number of people with critical or severe cases, and also the fatalities as well. And the fatality rate stands at 1.77%. However, we still have about 20.7% of fatality rate for those above the age of 80. And during the past week, we had 37 fatalities. Most of them were above the age of 80, and they accounted for about 43% of the total. And as for the sources of infection of these fatalities, most of them were related to hospitals and nursing homes, which accounted for about 43%, and most of them had underlying illnesses. And next, here are some updates on the new variants. And as of March 4th, we have analyzed 247 samples, and there were 220 local domestic cases, and out of 213 cases, we did not see the new variant. However, 9 of them are identified with the new variants, and 15 out of the imported cases did not have the new variant, while 11 of these samples have been the new variants, and 16 of them were UK variants, and 3 from South Africa and 1 from Brazil. And to this end, after August until now, we have seen 182 cluster new variants, and majority of them, 154, were UK variants. And as for the 20 new variants newly reported, 11 were imported cases and 9 were domestic transmissions. And out of the imported cases, 2 have been reported and identified at the points of entry, while the rest of 9 were reported while on self-quarantine. And all of the 9 domestic cases were Korean nationals, and they were related to previous clusters. And we have seen that our analysis showed that 6 of them were UK variants and 3 were South African variants. And to this end, we are also continuing to enhance and expand our scope of inspection for these new variants going forward, and also for all of the inbound travelers and their immediate family members. We all advise you to comply strictly with the quarantine measures. And the influenza virus here in South Korea, we also see that it is under the annual average threshold. And yes, last week we have seen a decline in the number of new daily cases. However, we are seeing a stagnant outbreak, and we see that we still have many risks of cluster infection, especially stemming from gatherings and also office buildings and workspaces. And first factor is that we are seeing cluster infections stemming from manufacturing as well as the small and medium-sized manufacturing facilities. And we see that most of them have employers of migrant workers, and they also live together in clusters and in communities. And also many of these migrant workers have less access to the testings as well. And second, we also had many indoor facilities, including ballroom dancing clubs as well as academies, saunas, and fitness clubs that have been subject to these cluster infections. And in the metropolitan area and Chungcheong area, the quarantine authorities are also intensifying our inspection for these workplaces as well as manufacturing facilities, and we will be intensifying our monitoring going forward. And second, we also have many increase of the physical contact due to more travelers in the spring, and we also have the new school year kicking off here in South Korea as well. And to this end, the quarantine authorities will also intensify our inspection, on-site inspection, and by regions and by the local governments, we also will intensify their own discretion and their own scope of these quarantine measures. And third, we also have new variants spreading here in South Korea as well, and more new variants are being reported here in South Korea, and we also have domestic cases as well. And we are also mandating all of the foreign entrants, including Korean nationals, to present their PCR negative documents. And we will also make sure that we contain the further influx of these new variants going forward. And lately, we have seen many cluster infections stemming from family gatherings and social gatherings, as well as indoor spaces that are subject to these cluster infections. And in the spring, which will also have more people hitting on the roads as well, we also fear that we will have more physical contact among people. So we ask you to, first of all, wear your face mask wherever you are, especially if you are indoors. And second, please comply with social distancing measures, including the gathering ban on gatherings of 5 or more people. And third, if you have any symptoms, please get tested as soon as possible. And next, as for the inoculation updates, we have some details. And as of March 8th, we have 316,865 people receiving their first dose of COVID-19 vaccines. And right now, the vaccination rate stands at 41.5%. And we also see this is the 41.5% of our total goal. And we believe that by facilities, 31% of the nursing hospitals have been vaccinated. And as for the first responders, we are currently carrying out. And COVID-19 hospitals, we have also finished the inoculation of about 21% of the workers. And we also have some updates on the post-inoculation adverse effects. We had 220 new adverse effects being reported as of yesterday, and we also have a total of 3,915 with reported the adverse responses. And out of these numbers, 3,866 are all mild symptoms, including a fever, headaches, as well as nausea. And we had 33 suspected cases of anaphylaxis and also 5 cases of convulsion. And we have 11 cases of death being reported, and these are under investigation right now. And starting from the 26th of February and until now, we have a weekly analysis of the adverse effects. Up until now, we see that 1.2% of the total inoculated people are showing adverse responses. And we see that we have a slight higher number being reported among females. And also in the 20s and 30s, we also see about 2% and 3%, and also 40%, about 0.6% among those 40s. And we see that the younger age group had more reports of these adverse effects, and about 1.2% of them were workers at these facilities, and about 0.4% of these people were the hospitals, the inpatients of these hospitals and care facilities. And we had seen a relatively higher ratio of these people reported at the nursing hospitals, followed by care facilities and COVID-19 hospitals. And by the vaccines, we see that AstraZeneca 1.1% were reported of the adverse effects, while 0.3% for Pfizer vaccines. And most of the these adverse effects, about 65% were muscle pain, and others were also very natural and common symptoms, including headaches and slight fever and so forth. And we are seeing the compensation for these adverse responses, which will be further explained by the respective officials. Last but not least, we still have some warnings and precautions for the inoculation. If you are scheduling to get inoculated, please get your vaccines when you are at healthy state. And before inoculation, please also record your any underlying illnesses or allergic reactions on your medical sheet and consult with your doctor. If you have these anaphylaxis or other severe allergic reactions, please do not get the jabs as well. And moreover, for all of the recipients, we ask you to stay at the facility for about 15 to 30 minutes to watch your condition and watch if you have any adverse effects, including anaphylaxis. And after returning home, please monitor your situation for 3 hours and also for the next 3 days as well. And after inoculation, please note that you could have some pain or swollenness or irritations in the location of the jab, and you could also experience a nausea, a headache, or fatigue, and a muscle pain or so forth. And please note these symptoms are common symptoms after inoculation, and they will disappear about 2 to 3 days following the inoculation. If you have swollen areas or if you have pain in the inoculated area, you can also use cold towels or also take some medicines as well. However, if you have severe allergic reactions or if you have also very high fever for a consistent amount of time, you need to visit a doctor as soon as possible and also visit a hospital as soon as possible as well. And next, we also have some compensation measures for the adverse responses of the inoculation. And we also have our medical experts joining the team.
Right, that was Seong Young with Monday's afternoon briefing. So what did she have to say?
Well, first off, the number of daily infections, domestic infections in the past week stood at an average of 370, which is similar to the previous week, while imported cases have dropped from around the 30s to the 20s. And also some updates on the variant cases. 20 new variant cases were reported as of March 4th, and 11 of those were imported and 9 were locally transmitted infections. So with that, the total number of variant cases in the country stands at 182, with 154 of those stemming from the UK. Now, last but not least, Tong also had some updates on the vaccination front. There were around 200 new cases of adverse reactions in the past day, and there has also been an assessment from February 26th to March 6th, and it looks like there has been a higher percentage of adverse reactions in younger people than the elderly, and 65% of those symptoms were muscle pain symptoms. And she stressed that most of these symptoms were common mild symptoms.
I see. All right, so thank you for that. See you tomorrow.
See you tomorrow.
Right, in this next corner, we share with you the experiences of those who have been inoculated and their words of advice before and after vaccination. Do take a look.
Korea is now heading into week 3 of its vaccination campaign. So far, the vast majority of people who received their shots say they either felt nothing unusual or experienced very mild symptoms that only lasted a short period of time.
크게 뭐 이상 증세 없었고요. 집에 가니까 이제 그 주사 부위가 좀 뻐근하면서 좀 눌렀을 때 아플 정도요. 그 정도의 아픔만 있었지 두통이나 뭐 어지럼증이나 뭐 이런 건 없었어요.
조금 울렁거림이 있었는데 한 15분 지금 앉아 있었나? 근데 지금 괜찮아요, 좋아요.
1일차 동안은 두통, 열감, 약한 몸살 기운을 겪었고 2일차부터는 2일차 증상에 추가해서 주사 부위 통증, 소화불량, 피로감을 더 겪었습니다. 주사 부위 근육통 이외에는 호전이 되어서 몸 상태는 아주 좋습니다.
Mild post-inoculation symptoms are nothing to be alarmed about, and a natural part of the body's immune response kicking in. But nonetheless, it is important to monitor your health condition on the day of your vaccination.
백신 접종 후에 나타날 수 있는 심한 알레르기 반응, 저희가 이제 아나필락시스니 알고 계시는 텐데요. 이런 반응이 대개는 백신 접종하고 나서 30분 이내에 발생하기 때문에 접종한 장소에서 관찰하고 돌아가시면 되지만 아주 드물게는 지연성으로 발생하는 경우도 있습니다. 그러니까 혹시 집에 가셔서 심한 증상이 나타나는 것이 있다면 의료진과 상담을 좀 받아보시는 것이 도움이 될 것 같습니다.
Pre-vaccination screenings and examinations are a must for those with chronic health conditions.
접종 당일날 건강 상태 이상이 있는 경우는 건강 상태가 좋으신 상황에서 예방 접종을 하도록 안내를 하고 있습니다. 접종 후에 이상 반응 여부 등도 면밀히 관찰하는 등 안전한 예방 접종을 위한 주의 사항을 유념해 주실 것을 당부를 드리겠습니다.
This recently vaccinated nurse has been carefully managing his health since getting his shot.
접종 2일차부터 피로감이 추가가 되었다 보니까 평소보다 한두 시간 정도 낮잠을 더 자고 두통과 소화불량이 근무 집중에 영향을 주는 것 같아서 타이레놀하고 하이스타를 하나씩 복용했다는 점이 있습니다. 그리고 접종을 했어도 항체가 형성되기까지는 한 2주 정도의 시간이 필요하기 때문에 지금까지처럼 이제 마스크 착용, 손 씻기, 외출 자제 등 개인 위생과 방역 수칙을 잘 지키는 것이 꼭 필요하다고 생각을 합니다.
It is also important to follow the required time interval between doses to maximize the effect of vaccinations.
2회 접종을 하는 이유는 더 강한 면역 반응 또는 더 오래 갈 수 있는 면역 반응을 얻기 위해서 그렇거든요. 지연 접종이 되었을 때 생각보다 예방 효과가 조금 떨어질 가능성은 있습니다. 따라서 권고되는 기간에 꼭 접종하시는 게 좋고요. 다만 백신 접종 기간을 놓쳐서 늦어졌다고 하더라도 처음부터 재접종을 권고하지 않습니다. 놓쳐진 접종만 가급적이면 빨리 접종하시면 될 것 같습니다.
COVID-19 infections can still occur in vaccinated individuals, especially if they've only recently been inoculated, meaning there hasn't been sufficient time for antibodies to fully form. Thus, as always, it's important to practice prevention even after getting your vaccine. Korea is still a long ways off from reaching its goal of herd immunity, so make sure to be on guard and follow strict safety precautions to keep yourself and your loved ones protected.
부정한 방법으로 예방접종 받는 것을 금지하고 이를 어길 시 벌금을 부과할 수 있는 부정 예방접종 금지 항목이 시설되었으며
국민들께서 백신 불신을 조장하는 가짜뉴스를 경계해 주시고 백신 접종에 적극 협력하여 주실 것을 당부드립니다.
Come tomorrow, that would be the 9th of March, those found guilty of interfering with tracing efforts or intentionally exposing people to the risk of infection will face legal consequences. Also, those engaged in disinformation will be punished. For more, I have Dr. David Kwok from Soonchunang University Hospital. Welcome back, Dr. Kwok.
Good afternoon.
And I also have visiting Professor An Jun-sung from Yonsei University. Good to see you again, Professor An.
Nice to meet you again.
Right, Dr. Kwok, despite the far fewer tests conducted over the weekend, we saw more than 400 infections on both Saturday and Sunday. What is fueling this relentless spread here in the country?
Well, I think it's really complacency that people are having. Over the holidays, obviously, we were quite worried about, social gathering and whatnot, so people are rather watching their distances and really careful not to come into contact with any other people. But now that have passed in a week or more, people are starting to feel more at ease. So I've just over the last weekend, I actually saw a lot of people just going out to enjoy the weather, and not only that, they were socially mingling as well. It's something we need to just remind ourselves. Nothing has changed yet, even with the numbers and also with the numbers spreading to others, and also the severity of the disease. Nothing has changed. So I would like to take once again a moment to really remind ourselves that the danger is still out there. If we become too complacent about this disease, it will be no time until it actually gets to us. So we should keep our guards up still, keeping 3 W's, watching the distances, wearing the mask, and also washing your hands often. But also at the same time, not only that, on top of that, we're also seeing a cluster infection still happening in some working places. But also, it seems like over the past week or couple of weeks, there was a huge number of confirmed cases that actually came out of the foreign people who are unregistered in our country. So I guess that is one factor that we also have to probably look into in the future.
Right, we do. And amid these concerns, Professor An, a legal framework has been set up against those maliciously seeking to disrupt containment efforts. Please give us the details.
Yeah, effective from tomorrow, the amendment to the Infectious Disease Prevention Act will take effect. And if there's any organization intentionally interfere with the epidemiological investigation, or does violate any government quarantine measure, the group member will be subject to enhanced penalty, which is up to 50% more than statutory limit. So, for example, if anyone intentionally interfere with the epidemiological investigation, the maximum penalty will be up to 3 years imprisonment, or the 30 million won. Excuse me. Right. So that's enhanced. So be careful about make sure that there's new enforcement came up take effect from tomorrow. And if you violate any government quarantine measure, there'll be about maximum penalty will be intentionally violate. They say it's a 1.5 year maximum imprisonment or the 15 million won. So also there's a new provision, I think Section 72-2, they create a compensation right to the government. So government have a statutory right to sue anyone who have some violated and spread the disease and to third person.
Right. And speaking about the government, Professor An, I understand members that have also decided to form a body that will address the claims for indemnity arising from violations of COVID-19 related regulations. What are the implications of such a body or such an entity?
Well, I guess I read the relevant documents, and I think it's about two things. First is sharing information among the government agencies, like a local and central government, and some local government having some problem getting enough information how to deal with situation. Also, about the guidelines, the central government come up with the guideline to the local government to how to deal with this. Also, I think the other issue is that there will be many local government, right? They have to be fair to the whole situation, right? So I guess that they keeping the guideline how to deal with what kind of level of compensation should apply to a specific case. So they come up with the case studies, also the guidelines. Also, the second thing is that they come up with the support to the legal support to the local government, because sometimes they don't have a legal staff to deal with situations. So plus the legal speaking, it's kind of this litigation. You have to prove the causation, whether this person's act or the inaction or cause the damage, right? So it's not easy to actually prove the certain kind of causation. So there's a central government come up with some guideline and legal hotline to provide legal support to the local governments, right? It's kind of more like, I guess, there's the standardized system and fair application to all the situation, throughout the country. I think that's the point.
I see. Meanwhile, Dr. Kwak, I understand you've prepared a list of false information about COVID-19 vaccination that you would like to rectify for us.
Right. So I've actually heard many different versions of this, and people are claiming that this could cure whatever. I mean, this could implement mRNA chips in our body. So I came up with a more common three list of things that people are currently saying. So number one, people are saying that these mRNA type of vaccines, they would end up manipulating our DNA. So we would end up getting some abnormal DNA afterwards. And that is entirely not true. If you think about it scientifically, mRNA, the name itself is called messenger RNA, and it works only as a messenger, and it doesn't encode into our genetic structure. So it has no way of actually adhering to the DNA and manipulating it by any chance. So that's completely false. And number two, the other claim that people were claiming was that dead fetal lung tissue was used in development of certain vaccine, and that is also entirely not true. There was one incident for a study that a fetal lung tissue cell line was used to test the vaccine's efficacy on. But there hasn't been any process or steps in the development of these vaccines that ever human tissues were involved. So that is also completely false. And number three, some people were saying that FDA emergency use authorization has such little time to go over these clinical trials that it is rather unsafe to use these vaccines. But I can assure on air right now that even through the emergency use authorization, whether it be FDA or for our case in the KCDA, they have a very strict process they have to go over in regards to clinical trials and allowing and approving for a certain vaccine or medicine to be used for any sort of medical and disease entity. So for the cases of COVID-19 vaccines also, despite it having been only through the emergency use authorization, I can assure that it is as safe to use as any other vaccines that we're currently receiving. So those three claims, I can debunk them as being completely false.
That is good to know. Meanwhile, Dr. Kwak, this is not my opinion, of course, but there is talk about these COVID-19 vaccines causing dementia, autism, or cardiac arrest. Are these true?
They're not true. So let's begin with that. There has been a case or two of transverse myelitis, sometimes also called Guillain-Barré syndrome, but it is kind of a different category of disease entity. One belongs to below the other category. But it was during the study covering up to about 50 to 100,000 of people being vaccinated, and that was just one case out of them. It also happens with any other medications or vaccinations, usually through that are injected. And then also over in the US and in Europe and any other continent, they're currently inoculating these vaccinations. They're not showing any particular direct causal relationship between vaccinations or any severe side effects. So particularly when we began with the vaccinations here in Korea, I am noticing that a lot of people are having relatively stronger reactions than we would have had with other types of vaccinations, such as fever or muscle pains, as KDCA head Jung Eun-kyung mentioned. We are noticing that, but it's not in a sense that it'll cause all of a sudden anaphylaxis. It would not necessarily be able to cause completely other aspects of side effects, such as transverse myelitis or causing quadriplegia. So that is completely not possible here. It's a completely different story. These sort of mild side effects that we are expecting, such as muscle pains or headaches or mild fever or even high fever, those are due to the normal inflammatory process that we are expecting to have from the vaccinations themselves. We're just trying not to have it too severely, and we're also trying not to have any other side effects that are aside from these. So those things that you just mentioned, I can say that they are completely incapable of happening from the vaccinations.
That is reassuring. All right. Professor An, I hear vaccine-related crimes have been reported in countries that started their vaccinations earlier. Do you care to elaborate?
Oh, you mean the crime, the
Yes.
cases? Well, I mean, I guess that like overseas case as well, like some in some country, they put the water and they say it's a vaccine, and some other very interesting cases. But I think that from the legal perspective, there's nothing new actually. I mean, the way we see any kind of medicine, any kind of food, you mean, right? Something come up, and then they come up with some people say this is a miracle water, and that's also only water sometimes, right? So I guess that I think the person, average person, have to use their common sense. A reasonable person, right, should take common sense and think yourself. And then if you're really curious, and you contact the agency, right, ask them, what is going on. And I think it's about the public trust issue, right? Whether how much people public trust the government, and then also the government perspective, how to minimize public anxiety on the vaccination, right? So I think that's the one. Government should take more time and the effort to educate the public and what to do, what shouldn't we doing, right? And why should we wear a mask? Why we should take vaccination, right? They have to explain why, and then also the public have to listen to what's going on and take a reasonable step. What should I do? It's a free country, right? You can say whatever you want to say, you want to believe in, right? But if you're sending misinformation or something impact on some other person's life or their daily lives, like that is legal responsibility, right? Kicks in, right? So you have to be careful. Whenever you say something, you trust something, fine. But when you take action, you have to think once again, is it reasonable to take this action, right? And that's important to the public.
All right, Professor An, as always, thank you very much for your insights. And Dr. Kwak, thank you for being with us today.
Thank you.
Right, now, if vaccines and safety measures are there to protect an individual, legal guidelines are there to protect the public. Having said that, thank you for watching and see you on Tuesday.